Ladies and gentlemen, please welcome Esther Krofah of the Milken Institute and our esteemed panel.
Okay, good afternoon, everyone. Good to see you. Thank you so much for joining this panel that's focused on revolutionizing global health care, equitable access, and improved health outcomes for all. It is my pleasure and honor to moderate such a distinguished panel, and I've already had a chance to speak with all of you. So I'd like to welcome our panelists. First, Dr. Jarbas Barbosa, Director at the Pan American Health Organization. Second, Dr. Githinji Gitahi, CEO of AmRef Health Africa. And finally, but certainly not least, Rita González, board member representing Latin America at Movement Health Foundation and CEO of Policy Wisdom. So welcome to all of you. Transformative science and innovation, it's the best it's ever been. We saw that clearly on display with the rapid development of vaccines and therapeutics to solve for COVID-19. Of course, that was built on many decades of prior research and development. And today we see innovation in genomics, diagnostics, digital health, the use of remote technology to bring health to diverse geographic regions around the world. We have a better understanding of human biology. We can even pinpoint precision treatments and medicines based on a particular biomarker for disease at an individual level. Tremendous science. Yet we see stark differences in health outcomes around the world. Much of the world's population cannot access these new innovations and technologies, and many are not scaled at sufficient levels to make an impact at a population level. Health systems continue to face challenges in workforce, infrastructure, scale-up, sustainability, lack of capacity, and critically important for us to achieve the impact that we want for health outcomes, we have to close the gap in health inequities. And many of the health systems, unfortunately, are falling further behind in achieving their goals for SDGs. So that's the wonderful backdrop that we have to engage this panel in a lively conversation. How do we revolutionize healthcare in light of all of these various trends and challenges that we see? I want to start with you, Dr. Barbosa, because you have been really at the forefront of leading the response for COVID-19. And as you're reflecting on COVID-19 and thinking about the region that you are overseeing, first, just offer some reflections on what I just talked about, these set of challenges on the health system side, and then we'll talk a bit more about the strategies and the partnerships that you're employing to solve them.
Thank you. Thank you for, I think that is a very important question that you raised. Of course, that the pandemic was not only a dramatic public health event, but also it produced several negative impacts on maternal mortality, routine immunization, delaying diagnosing treatment for non-communicable diseases. And the pandemic also highlighted some important characteristics that you have in the region. For instance, it highlighted the inequities that you have in the region. It highlighted the barriers that some vulnerable populations have to guarantee their access to health services. So when we see in almost every country in the Americas, Afro-descendants, indigenous population, the poorest families in each country were at a higher risk to develop severe cases of COVID-19. So I think that the challenge now is how we can implement the lessons that we learned during the pandemic, dramatic lessons that we learned, how we can strengthen the health systems to be more resilient, starting with a strong primary health care. A primary health care that is not the original concept, focused only on maternal and child health, but that can respond to the complex epidemiological scenario that you have nowadays, that can provide health promotion, surveillance, prevention, care for non-communicable diseases and communicable diseases. And I think that one important thing to do to achieve this is, of course, to provide the healthcare workforce ready to work in this new and strengthened primary health care, but also to use the one legacy from the pandemic that is the use of new technologies that can empower communities and persons because they can have their data, they can receive reminders for everything, that can use telemedicine and teleconsult to provide better quality of care and better access to people living in remote areas that can support the healthcare workers. So this digital transformation that we are talking about is indeed how we can remove the barriers, how we can increase the access that probably is one of the main challenges that you have nowadays.
And of course, to achieve all of this, you need partners, right? Can you talk a bit about what kinds of partnerships you're putting in place? Are you working with the private sector to achieve this? That digital transformation, of course, is leveraging technology created in the private sector.
I think that is very important, of course, that when we talk nowadays about the private sector, we are talking about a broad range of different institutions, but we are trying to have a very close collaboration with health services providers, pharmaceutical companies that we have a long-standing collaboration, and they participate in our two funds that we have to reduce the price and to provide more access for vaccines, medicines, and health technologies, but also with the newcomers, let's say so, because if you are really talking about the digital transformation, we need to have a dialogue with the internet providers and telephone companies in the region. So I think that it's important to have them on board, to establish in a very transparent way with no conflict of interest, but to have them on board discussing and find what are the better solutions to address these problems that the pandemic highlighted in Latin America and the Caribbean.
Yeah. And Dr. Gitahi, when we think about revolutionizing healthcare, what does that mean from your perspective? What are you working on the ground? Certainly you have a broad reach across Africa. Why don't you tell us a little bit about your vision in transforming healthcare?
Yeah, thank you very much. And I think I've listened to Dr. Barbosa, and I think it's kind of the same approach. The first thing to say is that we work with communities in 35 countries in Africa, and we work at community level. So the first thing we have learned as AMREF Health Africa is that to revolutionize healthcare is to remove care from health and make care a subset of health. That means that we need to remove the medicalization of the system and make it more people-centered, and people's biggest needs are actually health and well-being. The care comes when systems fail. But the first and the most primary thing that we must all do so that we revolutionize health is to revolutionize health, not healthcare, and care is just part of it. And if you look at the primary health care model or the primary health model, it looks at primary care as only one element, but the other two elements are community empowerment and multi-stakeholder engagement. So if we actually took a step back from the medicalization of this entire system, of this architecture, the focus, the overdriven focus on doctors, for example, the overdriven focus on equipment and facilities, and we took a step back to the community, we find that actually the community is the basis for healthy populations. It is actually where we focus as an organization. It is where we believe that everybody should start about ensuring that women and girls are given the right to, to their health, to ensure that communities understand nutrition, to ensure that communities understand through community health workers that they're the agents for healthier populations. And then the facilities, the care side kicks in when things fail. But the care side should not be where we start. We should start with the people-centeredness and move towards care as secondary.
And how are the resources being divided against the two, right? Because there's a lot of resources that's poured into the care side. You're talking at the local level, community health workers, empowering women, empowering girls. Are you seeing funding go toward that space? Are we really able to leverage that workforce to revolutionize even on the outcomes that we all want to achieve?
Yeah, that's an interesting question. I think we need to ask which resources. On the side of what we call health financing, what we define as this is health financing, that is often always taken to care. But then you must ask, what other resources do we have, and how can we also repurpose the care money to go down all the way to community health workers? We know community health workers, for example, work as volunteers in Africa, so they are not paid, yet they are the foundation for health and well-being. So we need to repurpose the care money to actually have money for promotion, prevention, and keeping populations healthy. Secondly is to expand our view of what health financing is. Health financing is not purely the money you use to pay doctors, buy health products and technologies, and maintain facilities. Water and sanitation, for example, availability of water and sanitation is a health investment. Availability of nutrition is a health investment. And this is where we must expand our view to actually start to look at these areas of keeping populations healthy and ensuring that that is actually the basis for everyone's work to revolutionize health.
Yeah. And Rita, of course, you are an expert in policy. That's obvious in the title of the organization in which you lead. And policy underpins what we need to do in order to achieve equitable health outcomes. It's interesting to see that with health systems maturing, policy is actually getting strengthened, and you're seeing the trickle-down effect in terms of the outcomes. Can you just tell us a little bit about why is policy so important, and maybe some examples of how you're using it today to expand access to health?
Sure. So policies, I think, other than potable water and vaccines, is maybe the most important tool for public health. Because if you have innovation, if you have services, but there is not a policy underpinning them, you cannot mainstream it. They don't become part of the normal services. They don't become into that non-healthcare or healthcare. So basically, policy help us get the deepest and broadest access. And when we're talking about innovation, it becomes even more important because we can try to ensure adoption, integration, but without policy, it would not happen. Collaboration, as Dr. Barbosa says, is essential with atypical partners, not the partners that we use every day. And also, the importance is, to me, is the forgotten child, which is the understanding on how innovation works. Because many countries, many health systems do not innovate because they think it costs more. And what it happens is that you have to invest more at the beginning because usually you have to run parallel system or you have to train workers, and then we don't have policies that allow for that initial investment and to demonstrate that eventually that investment is even lower than what we're paying now or provides even more better outcomes. So at Movement Health, what we are doing, it's a new foundation. Our interest is digital transformation for health. We're emphasizing on cardiovascular and we're emphasizing on oncology. And what we are doing is working from the community up. And I think the three of us agree that that's the way to go. Basically, we start with roundtables with those multi-stakeholders, and we talk to them about not only what are the real problems, but how in your country, in your communities, you see are the real barriers to those problems. And then based on those barriers, we work with them to try to identify who are the stakeholders that will want to work on a solution and build a solution with local entrepreneurs, with local health systems, local hospitals, local primary care, with tech companies, with everyone that can be a part of it, including medical providers, broader health providers, public health institutions, and of course, the patients, the individuals that will be affected. And we are having really good traction. We're starting to see things changing. In Colombia, we have a beautiful project to reduce the risk of cardiovascular health, cardiovascular problems. And we are seeing that the impact of a small project that is digital, that demonstrates to the health system where are the focuses of the risk of the people that will end up in this hospital with an adverse event, is getting so much traction that the Ministry of Science and Technology is funding it with $1 million to send it to a region that is maybe one of the most deprived in Colombia. So we're starting to see that these actions are generating change. And of course, it's very important to us that we're not talking about let's create policies and then do the work. No, we are helping develop the work, and then that's why you should have a policy. So this is not for a few, but it's for the majority.
I mean, the idea of scale is critical to all of that. And what you just talked about demonstrated that scale. You did it in one area, one community, and then it's being taken up at the higher level and being expanded across with the country. So
and not having to reinvent warm water. If you have good solutions, let's share it with everyone that can benefit from it.
Dr. Barbosa, I want to come back to you just to talk about your priorities over the next 2 to 3 years. What do you want to achieve with the reach that PAHO has? What are the top areas that you're going to focus your time and attention?
I think that you have two important things. One is to recover better than we were in 2019. I think that this is the moment to start using all the new technologies, new strategies, to rethink the way that we are promoting health, that we are preventing, that we are providing care in order to recover from the negative impacts from the pandemic. I think that this is the one, because even before the pandemic, we, in the Americas as a whole, since 2015, the routine immunization coverage was decreasing for several different reasons. Maternal mortality for many countries were not in the right track. The reduction of the preventable deaths related to non-communicable diseases were also not progressing as we want to progress. So I think that this is the moment to use the digital transformation, the new technologies, PCR tests, all the things that we have now to make a more equitable advance to achieve the sustainable development goals in the region. And the second is to implement the lessons learned. One of them, for instance, to have a global agreement that will, for instance, that will respond to maybe one of the most important failures that we had during the pandemic. That was the lack of equitable access to PPEs, to ventilators, to medicines, and to vaccines. We will not be better prepared for the new pandemic that will come if we don't have a global agreement about that.
Yeah, that's fantastic. And of course, there's a lot of work that's happening right now in the deliberations around the pandemic accord, and hopefully that has the right, solidarity, that's the word I've heard throughout the day today, in order to achieve that. Dr. Gitahi, I want to come to you just to talk about, as you think about the next 2 to 3 years as well, in achieving equitable outcomes. When I painted that picture earlier, it's quite stark. How do we get vaccines, therapeutics, diagnostics, all of this innovation, leveraging the community health workers? Are there some specific examples of what's happening now on the ground that's giving you hope in the next 2 or 3 years?
Yes, absolutely. And I think if I was to think about the next 3, 4, 5 years and up to, to 2030, we have a new strategy to 2030, is to think about how to protect the world by keeping the remotest community healthy. Because that's where the index case for the next pandemic is not going to happen in Geneva. It's going to happen in the corridors of New York. It's going to happen somewhere in a household, in a village. And by keeping that village healthy, by training community health workers, by making them the eyes and the ears of the health system, then that is where the hope is going to come from. And I can give you one example. Many of you may have heard of the Marburg outbreak in Tanzania, and also had happened earlier in Burkina Faso, in Equatorial Guinea, sorry. In the case that happened in Tanzania was a case of a family that had somebody who was sick, and they called a motorcycle rider. The motorcycle rider transported this person to hospital. They died, the person died, and then another 3 also got sick. They were called. And then the village, very distant village in the rural Tanzania, rumors started circulating in the village. And this community health worker that had been trained by AMREF with technology, meaning they had a mobile phone to do electronic event-based surveillance, a 21-year-old young woman actually went to the app and said, there's a rumor going on that 5 people have died, and loaded that. And that's how the Minister of Health in Tanzania picked up the Marburg outbreak and controlled it. There is hope.
That I see is an early warning system.
Yeah.
We need that kind of technology everywhere deployed.
Yeah.
And Rita, let me come to you. Just tell us a little bit about the other projects you're working on. So Colombia is fascinating. That was a great example. Are there other areas that you're working on that you're excited about?
Yeah, I'm excited about Cusco. I'm excited about the fact that in Cusco, we realized that patients were in a place, physicians and nurses were in another, and we, through data, make sure that the demand and the supply were together, and that has impacted maternal health significantly. I am excited that around the world, our projects are not only getting traction, but are being seen as real solutions because they come from the community and they deliver. And I'm excited that I think with the leadership that we have now, if we think poverty is prevalent, what about health poverty? Yeah. Because health poverty is more prevalent than poverty, because people in the middle class do not have access to health. So I think that is what we all want to do, and through Movement Health, we really want to move towards easing that health poverty and making sure that equity becomes a reality.
Yes, well, I mean, with the work that all three of you are doing, I think that leaves all of us with tremendous hope that we are going to see transformation in the next several years. We certainly have to grapple with the lessons learned from COVID-19 and make sure that we're able to put in place new strategies, new policies, new infrastructure, new architecture in order to solve for that. And incredible to hear what's happening in remote regions around the world and the role of technology to enable that. Thank you so much, Dr. Barbosa. Thank you, Dr. Gitahi. Thank you so much, Anna Rita. Thank you all.